Good. Good morning, everyone, and welcome to our eLotus webinar. My name is Donna, and I will be your host and your moderator for today's class. So if you have any questions regarding any products or services that we have here at eLotus, I'll be happy to help answer them for you. Also here behind the scene is Sam, our tech. So if you do experience any technical difficulties today, you can go ahead and private chat with him, and he'll be able to help you when he is available. Here at Lotus Institute of Integrative Medicine, we have been holding educational seminars and webinars for over a decade, and it has been such a wonderful journey filled with many experiences and lessons, taught by speakers who are not only experts in their respected fields, but more importantly, they are willing to share their wealth of knowledge with all of us. We believe that the future of TCM and the advancement of Chinese medicine can only be obtained through continued growth, learning, and progress. And that is one of our main goals here at eLotus. And of course, we wouldn't be here without the generous sponsorship from our sponsor, Evergreen Herbs. So at this time, I'd also like to thank all of our Evergreen customers joining us today. Today's webinar will run from 9 a.m. to 6 p.m. Pacific time. We will have a 1-hour lunch break from about 1 p.m. to 2 p.m. and 2 short breaks in the morning and 2 in the afternoon. Today's class has actually been pre-recorded, so what we're going to do is play the recordings for you guys, and then at the end of the day, Dr. Chang will be answering the questions that you submit to our email address, info@elotus.org. So if you have any questions relating to today's class, which is any cardiovascular or respiratory disorder questions relating to the notes, like if you don't understand a pulse sign, or if you have a question on why he chose a specific herbal formula, you can go ahead and email those questions to info@elotus.org. Alright, so let me go ahead and give you a quick tour of our webinar room. On the top left-hand corner, you will find the video feed, and then to the right of the video feed is the PowerPoint. Now you do have lecture notes available for download, and you can find that back on the blue course access page. You'll see a white icon that looks a little like a notebook. It says lecture notes. You can click on that to download your PDF copy of the lecture notes. Now for the PowerPoint box, you can actually make this one full screen. And if you look right above that box, you'll see a button that says full screen. You can click on that, and your whole screen will just be the PowerPoint, and you would just hear audio. But if you like to watch Dr. Chang speak, you can just leave it as it is. In the bottom box, you'll find 3 boxes. The first box to your left is the chat room, and here in the chat room, you can chit-chat with your colleagues who are also attending the webinar from all over the world. So you guys can interact with each other. If you have any questions that you would like to ask someone else, you can definitely type it up in here, and then someone will answer your question. And if you see a long-time colleague that you haven't spoke to in a while, you can also private chat with them. And you can do this by moving your mouse to the top right-hand corner of the chat room. If you do so right now, you'll see a box appear where the horizontal lines are, and then you can click on that and then select Start Chat With, and then you click on your colleague's name. And this will begin the private chat with them. Now in the middle box, you'll find upcoming eLotus events, information about today's webinar, such as the gift certificate information. This one, it will be rotating every once in a while. And then the last box to your right, you'll find upcoming eLotus events and information about our sponsor, Evergreen Herbs. So for today's webinar, and if at any time you experience any technical difficulties such as slowing, skipping, or stopping, you can do some troubleshooting, such as pressing F5, and that will refresh your screen. If that doesn't work, you can close your webinar window and restart it again. We do recommend that when you join us for a webinar, you are connected to a source of internet that is high speed, steady, and preferably wired for optimal audio and video streaming. Just like to remind you guys also that the Adobe interface allows 1 login per user. So if you're logged in more than once, more than likely you'll be hearing echoing sounds. So what you can do is just close the extra window, and also after a period of time, Adobe does remove the extra login. And if you are, just a reminder, if you're watching today's class live in real time right now, today is Sunday, November 17, 2013, you will be eligible for CEU credits, and I'll explain later on today how to take the quiz to get your credit. And also part of the webinar package is a 2-week viewing period where you can go back to today's class and watch it again in case you want to hear an important part of the class again. All right, so today's class will focus on cardiovascular and respiratory disorders, pulse diagnosis, and herbal treatment. So if you were here for Bob Jones' class yesterday on pulse and herbs, the interactive case studies, Bob does mention that he learned his pulse taking skills from Dr. Jimmy Chang. So today you are learning from the master himself. So yesterday Bob talked about pulse signs and where to put the pulse, and today Dr. Chang will tell you exactly where to place your fingers, and it'll be a refresher from yesterday's class. Dr. Chang is a doctor of Oriental medicine trained in Taiwan and is a licensed acupuncturist in both California and New York. He does have over 35 years of concentrated clinical experience applying his expertise in differential diagnosis and herbal prescription. He is the author of the Pulse Diagnosis Manual Pulse Synergy and is currently pursuing his specialties in Hacienda Heights, California. He is widely recognized for his skills in correlating definitive pulse diagnosis with herbal treatment. So we're going to go ahead and start the tape for you guys.
Well, ladies and gentlemen, I'm very happy to be here to have this opportunity to share all my information and all my experience using herbal treatment and combination and things I discovered lately with you. I'm going to share with you something, how to use the herb and how to make money too. How to do something to convince and to help your patients with. So today we're going to start with my pulse diagnosis. And we'll be talking about respiratory system and the cardio system and my method of using herbs, my idea, my concept. And now, and this book is very, very useful. Some part of it is very, very important. I'm going to show you how to use this book later. I use my herb, my formula in a very special way. If I don't explain it, I don't think anybody can understand what the hell I'm doing there. Even those Chinese doctors don't understand the way I use my method, but it works. My patients will happy. And my way of making diagnosis is very effective and very interesting too. So in the beginning, we won't be talking too much theory. We'll be doing real work starting right now. So in the beginning, I'm going to ask you politely to remove your watch, to take off your jacket, take off your sweater, roll up your sleeves, and show me both of your arms till the elbow. Next time I'll be yelling at you. Take off your watch. Come on, Eric. You don't have a watch? Okay. I want to see both of your arms because we're going to use them. Okay, let's get on with the interesting part, because everything followed will be very important because we have to use the pulse diagnosis to know what herb to use, what formulas to use. So that's the first beginning. We must know how to make the correct diagnosis. For example, you do acupunctures and herbs, right? So let's suppose there's a patient come up to you and say, hey doctor, I have a shoulder pain. Okay. Shoulder pain. We already know the answer. But in my office, they don't tell you anything. You have to find out if this guy is having a shoulder pain or what. The final goal of taking pulse, the pulse diagnosis, or actually the final goal of my practice is don't ask. When a patient sits in front of you, don't ask anything. Let's take a look first. Let's find out all the problems he has. Let's get all the information with our ability. We don't ask until the last. We ask, okay, what do you want me to do for you today? That's mostly the most thing I ask. So, but let's pretend the patient has already told you that, hey, I have a shoulder pain. Now it's your job to treat the pain, right? With acupuncture, with Chang's method or whatever. But actually, there's a lot of things hidden behind that symptoms. The pain can be the reason for arthritis, for frozen shoulder, for injury, for falling off the pillow, even for cold. Or even sometimes the pain was caused by hepatitis, by liver problem, or by other kind of problem. Mostly the shoulder pain can be the result of a gassy intestine, small intestine, and can be the result of some coldness, or even the shoulder pain can be the result of the respiratory system, what we'll be talking about today. So before you decide what needle or what herbs you have to find out the reason for his problem. And that's the time you must do the diagnosis and ear point. I'll be sharing with some experience using this. It's very active, very, very accurate and effective. I found out some cancer yesterday just with this. Sometimes it doesn't appear on the pulse, but we combine together. We'll be sharing with some palpation and some eye. The observation of the surface color and temperature to gather all the information as we can without asking anything. Okay? But in the beginning, let's do the pause. Let's try it. My method is a little bit different from your textbook. It is the same thing in Taiwan because, okay, okay. Even in Taiwan, those Chinese doctors, they graduate or they pass the examination, whatever, they don't believe the pulse diagnosis because the method that was taught in the book was not so correct. I hate to say it. People always say, I don't say that. Okay, whatever, but they're wrong. So they don't believe it. Because they couldn't find anything from that method. They couldn't find anything, but I can with my method. Just a little bit difference. Let's not say they're wrong, but let's say I'm right. Because it works every day, come on. It's so practical. So I'm going to tell you right now, okay? Let's do the finger positions. We'll be doing step by step. There are several ways, not so difficult. Do you have a laser pointer? Okay, there is styloid process. This bone, we call it peak, the highest point here. It's not on the ridge, it's inside arm, somewhere here. There's the highest point. Let's locate it first, okay? I suggest you mark it with your ball pen so I'll be able to verify if you get it right or wrong here. Because it's not on reach. It's not on here. It's inside somewhere like this. Okay, let's try. You mark it so I'll be able to tell you right or off. If you put a finger on top of the skin, you move a little bit, you'll be able to find the highest peak very easily. See? Okay? Okay. Now let's try to feel the pulse, okay? When we do our own pulse, we do it from outside. It's a little bit awkward, but let's try it in the beginning. Let's do it from outside. Don't ever touch the pulse like this. Even you're trying the other people's pulse. Oh, come on. This one. We do not do it like this. That's fake. That's only making believe. They couldn't do it this way. We must do it from outside. So the other hand, we do it from outside. From our own pulse, let's feel it a little bit from outside. Okay? And let's try it. You should put your thumb against the back of your wrist and make sure there's an opening, there's a space where you can put an egg into it, like this. Okay? From the inside, like, what? Oh. Yeah, don't do this. This is the fake one. This is the real one. But for our own pulse, let's do it from outside. Let's check it, okay? With your thumb against your back of the wrist, like this. No. And keep your finger, another picture. Oh yes, Make sure the tip of your fingers don't turn white. Otherwise, you'll be pushing too hard, this area. So, and keep your, oh yes, this is bad. See, the tips of finger turn white. That's bad. Because you're pushing too hard, you won't feel anything. Come on, try it. From outside, yep. Boy, that's beautiful. Okay. I want to see the elbow, come on. You know why do I want to see the elbow? We'll be doing something with the respiratory system, and you can see something before you take the pulse. You know what's going on in the lung, in the respiratory system. That's in the elbow. So I want to see the elbow. Come on. Show me the elbow. Okay. Oh, this is, yeah. This is what we are supposed to find under our fingers. Okay. Feel the strength of the pulse, weak or strong, level, superficial or deep. Feel the diameter. We don't know how to measure the diameter, but let's imagine, because we cannot see anything. So we have to use our imagination, thick or thin, and the shape. The shape is very interesting because in reality, this is just a tube, right? Just a cylinder that transfers the blood. But actually, it is not. It's not like just a simple cylinder. It has a lot of strange shapes. Sometimes it's shaped like the back of the turtle. Sometimes shaped like the sea waves and everything. No, later. But now, let's feel it. Let's try the hand method in a more advanced way. Let's try the hand method on somebody else, on your friends. Okay? Let's try it, and let me see how you handle your fingers. And because you have to do it correctly, so you can feel anything. I'll tell you what. It's very awkward to do the pulse taking with friends besides you. You should do it people behind you. Okay, you can get up and whatever you like to try to feel something. Different people, different body type will have different pulses. 好，这白的不行。这好，太好了。Make sure this point that we marked before is right between two fingers. The next one. This is the actually this is the traditional one that was said in your textbook. Put your middle finger on top of it. It's not that accurate. This is my method. It's more practical. Your final goal will be, don't ask. This might be a little bit difficult, but at least you should try to achieve that. Do you have anything about this categories? Oh, yeah. Okay. There are several groups and they're weak and strong. So you should at least feel the pulse is weak or strong. Let me explain the distribution of the position later. But this is what we should feel under each finger. You should tell yourself, you should ask yourself, okay, if what kind of condition this pulse weak or strong? Weak means deficiency, excess fire or something. We'll be talking the respiratory system this today, and I'm going to share with some very interesting way of picking herbs to deal with the fire. Fire means inflammation, infection, is either a virus or bacterial or whatever. It's not so easy like we thought it should be. Sometimes the fire is very difficult to put up. But we have different ways of picking herbs to deal with that excessive fire. Sometimes a cough can be very stubborn. You know? Okay, it's a superficial. Superficial means when you touch the skin gently, you feel something jumping under your finger. You should try to imagine. There's no way you can see it, but we should try to imagine that there are three springs under each finger, just like you play the trumpet. They have three valves. Okay, there's three springs under each finger. So try to imagine the three spring might not be the same level. One of them may be broke, one of them may be too strong. So it's not always in a level condition. It's not always like a tube. Sometimes maybe one of your fingers higher, one of the rebound under your finger maybe weak, maybe too strong. So if you can touch, let's try it. The right chun, the first position on your right hand, it always superficial. The right, we call it, the term is chun guan ci, like the book, okay? Chun, right chun means the respiratory system. We'll be focusing on that today. So if the guy is having a cough or something, we should try to find out what's wrong with his lung. The right chun is the lung. But if you say your lung superficial, not yours. You're a very interesting case. In the content of today's stuff, your condition. Okay, how about yours? How's your right chun? Is it float? Is it deep or superficial? Let's focus on these two categories. Superficial, deep. Come on, feel it. Right chun, right hand. Come on. Superficial? Is it superficial? No. Huh? Is it? Or you can tell. Let me know. You write it down. My right chun is not superficial, and I'll check and verify it for you later. Or it's deep. Right chun is weak or strong. Your right chun. Just focus on one point. Right chun. Don't look at me. Check your pulse. Strong or weak. Don't just keep on pushing it. Just let it go and up and down, up and down. Try to find all those feelings. It's strong or weak. Weak. You write it down, okay? And I'll check it for you later. You might forget it right away. Okay, what about, You write it down. Weak is only one category. This is group 1, okay? You say weak. Okay, let's go to the group 2. It's superficial or deep. That's the thing we're going to talk about this today, so be focused on it. So the second group is superficial or deep? Normal, just write it down. It's normal. I'll verify and see if it's normal. I don't believe that very well. It can be very normal. You write it down. Okay? If you are sure about this group, let's go down to the third group. The thin or thick? Thick or thin? That means the diameter. There's no way we can measure it, but you can feel it. The thin means just like the paper edge. That's called thin. Thick is like an earthworm. Okay, just like the core of your ball pen, something like that. That's called thick. Okay, if you are sure about the previous groups, and then let's focus on this group. The thick or thin? Thick or thin? Thick. You write it down. Okay? You write down, I'll verify for you. It's important because that's the category we're talking about today. Okay, now we have 3 words, right? From each groups. Okay, is weak or strong? If you haven't decided, then feel it again. Weak? I don't believe it. Not much people have a weak lung. Unless it's virus infection. A flu, I mean. Most of people, 99% is strong. Well, I'm not going to influence you. Just feel it yourself. Write it down, come on. That's 3 words. You're weak. Oh, after eating all those Chinese food? Okay. Weak or strong? Make up your mind. Come on, patience waiting. You can't spend too much time on 1 point. You have 6 points to go. Actually, more than 6 points. Yeah? No, just sit there quietly. Don't talk. Okay, have you decided yet? Okay. How about superficial or deep? Superficial means when you touch the skin gently, very gently, lightly, then you can feel something jumping under it. Deep means you cannot feel it, so you have to push down a little bit. Wow, it's down deep there. Deep is inside. Deep there. Okay? In 黄帝内经, the superficial means dryness. And deep means dampness. So even this guy or this girl is coughing seriously for many weeks or many days, and it is very clear that she has bronchitis or what, asthma, doesn't matter. You have to decide what kind of fire he has. It's dry fire or damp fire. Then we can pick the medicine. You know what I'm saying? It's not just antibiotics. We got a lot of stuff. Make sure, this is very, very important. If you use the wrong word, if you use the wrong herbs, the condition will be worse. Because don't listen. Well, sometimes you should. To listen to his cough. Maybe he's not coughing sitting in front of you. But you still have to find out the nature of his cough. If it's superficial, that means dryness. Now we have something accurate to moisturize the dryness. Dryness is very difficult to treat. For deep means dampness. Okay? Deep means 太阴. In 黄帝内经, 太阴 means dampness. Means too much water in this whole system. So you have to use something to what? To dry it up. So the nature of herb should be constriction, the astringent, and should be what? Should be sour. Okay, we decided, we have made up our mind about this previous groups, and what about this? Thick or thin? Thick. Usually we don't have thin. Most of the time, especially in California. I was in Arizona last month. I think a lot of coldness there. Okay, it's thick or thin? Thick means expanding. Expanding means the fire is raging. Thin, what does this mean thin? Constriction means that everything is shrunk. All the passage becomes so narrow. So at that time, what kind of medicine we do not use for this expanding condition? He may be complaining, oh doctor, I'm so tired, help me. Yes? Yeah, normal is somewhere in between. If you feel yourself is normal, write it down. Write it down. And I will verify it for you. Okay? So it's thick or thin. Your own pulse. Don't look at me. Feel it. Thick or thin? Her right twin is very dry. It's thick or thin? Most of the time it's thick. Thin is a cold condition which is not very commonly seen or something. So you write it down. Don't let me influence you. Just write it down. I'll check for you, okay? So put them all together, three words from each group, then we have answer. And that answer will direct us to pick the medicine to use. Sometimes it's different. Okay? Any questions about the pulse stuff? 2 minutes? 2-3 minutes for 6 positions. Besides 6 positions, there are 8 extra meridians. And the ear points too, in about 3 minutes. Everything. I don't ask, I just keep on saying my stuff. Yes? Yeah. 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 Yeah, that's definitely strong. Yeah. 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 But if you push down a little bit, the pulse just disappears, become weaker. Then it's weak. That's some kind of in deficiency. In is inside, it's deficient. So this is the first point. Okay, what about second point? Okay, let me explain it. This is the lung, like usually in the book. And this is the stomach, digestion system. The third one is the kidney. This is the real kidney, not hormone condition. It's not hormone or adrenals or something. It's real kidney themselves. The left one is heart. We'll be talking about that this afternoon. It's very interesting. We have there was a singer in Taiwan. He died a few days ago at the age of 48. He was chubby and fat, and he drank like crazy. Okay. Ma Zhaojun. 48. Died all of a sudden. He has a baby born less than a month. The left one is liver. Okay, left is the sex part. If you're treating somebody with the infertility, you'll be focusing on the left, and still with all those categories to consider. How's your sex condition? How's your left? Is it dead or alive? Too strong or too weak? Or too much water? Or inflammation? Or cyst? Or fibrosis? Anything? It's all on the left. Okay? We can detect it and we can cure it. We'll be talking about that in another seminar. We'll be talking we'll be talking both twin today. Right twin and left twin. So how is the left twin? Let's try it for a few minutes. Am I too fast? You haven't seen anything yet. Okay, what about your left twin? Let's go back to to this. You can I always suggest my students in Taiwan that you make a checklist. You print yourself a checklist in your own way, whatever you like. 寸关尺, left hand, right hand. Because when you touch the pulse, maybe this is the first time you ever try to feel the pulse. Whenever you touch your skin, I believe there's a lot of information in your head that give you a lot of confusion. So you can do it by looking at the chart and mark it according to the checklist. That'll be easier for you to differentiate all those elements. So how's your left twin? Is weak or strong? How's your left twin? Left twin is your heart and your brain. It's very important. Is it weak or strong? Weak. Okay. Okay, it's weak. So what would you like to give to her? What kind of herb? Let's pretend, okay? I don't believe it's weak, but whatever. If it's really weak, what kind of herb you'll give to her? Maybe her major complaint is dizzy, insomnia, losing memories, all that stuff. What kind of herb would you like to give to her? And she major complaint, oh, doctor, I'm so weak, I'm so tired. Let's pretend it. Huh? What? Left twin. Let's pretend all other parts are normal. What kind of herb would you give to her? Huh? 桂枝汤. 桂皮汤. Okay. 桂皮汤 is for spleen, not directly for the heart. Huh? She has a weak heart, and really the pulse is so weak, and she's so tired. There's no blood going to the brain, and we don't have that. You do? She said she doesn't have it. They don't have it. How come you have that formula? I don't have it either. I don't even have a Yangxin Tang. Come on. Okay, what else? What else? Come on. 天王补心 is not right. Sorry. Okay, what else? 天王补心 is for another kind of pulse, for the regurgitation or something, for floating. Okay, what else? Anything to strengthen her heart, enhance her blood circulation to the head, make her young again? What? Yeah, Samasan is much better. To bring the pulse back, to bring the energy back. And anything else? Yes, yes, good. Any more? You want to add it to it? Hey, come on, the patient, we don't have it. They don't sell it to me. Yeah. Come on, the patient's waiting. Anything else you want to add? Oh no. Oh, that's it? Or you want to add something? Huh? 人参? This is too expensive. Ask him to buy it in the store himself. Yes, that's correct. But make sure he's weak. How do we know this is really a young deficiency? Maybe this is a fake sign. The heart is weak, but her blood pressure is maybe high. Or he may be very greasy. Her circulation may be stuck. But her brain power is down. But somewhere else have more problems. So before you decide what kind of medicine to use, at least you should try her blood pressure. It's very, very important. Even for a weak pulse, people can have severe high blood pressure, over 180 or 200 or something. So be careful. I'm not talking about you. I'm just giving you an example. Okay, this is just for us. Okay, any questions? I'll finish it. How about your left swing? How do you feel? Write it down. I'll explain. I'll check and verify it for you. How's it? Weak? Huh? Anybody have a very strong left swing? No? You do? It's strong, but not floating. It's deep. Deep and strong. That means blockage, stasis. Oh yeah, you have to combine all three groups. Floating or deep, strong or weak, thin or thick. Put them all together, you have an answer. Okay? Write it down, 3 words for me. Your left turn. Floating, strong, and what? Yeah, you're right. Okay. So what's the partner of heart? Small intestine, right? And also the guan is gallbladder and chi is bladder or something. So how do we differentiate that zhang and fu? Not by floating or deep. Okay? It said in the book that floating is superficial, deep is internal. Not necessarily. Floating means dryness. Deep means dampness. And the way we tell how much is the problem with the zhang or fu is by their qi. What do you mean by their qi? What's the name of small intestine? What's the name of the meridian? Small intestine? 太阳. Okay, we have 6 qi, 太阳, 少阳, stuff like that. And each qi has its own unique pulse. That's in the 黄帝内经, is my advanced class. But let's say, if there's a strong pulse on top of the left turn, it could be a small intestine. Okay? We will talk about it later. Just make sure that you remember the name of the qi. What's the qi for large intestine? Yangming. So where's the position for large intestine? I mean the position, like somebody tell you that, yeah, I have a problem with this large intestine. So at least you should know where to look. Where? Right side. So they combine together with the lung. So how to tell the difference between them? That's the task. Okay? Okay, any questions so far? No questions? Am I too fast or not? Okay. What's next? Yang means short. In 黄帝内经, Yang means just one word, short. Oh, this is my 8 extra meridian pulse, just a brief introduction. Okay, this is 寸关尺, 寸关尺. The middle is the belt. It's the 带脉. 带脉 means that something in the middle. Actually, in our practical, in our practice, you should focus on the diamine. Most people have the problem with the diamine. What diamine means? Diamine means the belt, right? So the problem, what's the problem? There's the two categories. First is too much. Second is not enough. That's the first thing you should tell yourself. When you take a pulse, first you should decide the pulse is the evil qi in his body or his normal qi is too much or not enough. Very simple. So most of the time, let's check your own daimai. Yeah.
Just say a little bit more about how to distinguish between the large intestine problem and the lung problem on the right side.
Oh, that's difficult. Okay. What's the qi for lung? Tai. Okay. You all know the kidney, for example. Kidney is a combination of what? No, what kind of evil? I mean, 风寒暑湿燥火. Like 5 elements. Water and fire. Just like man and women, yin yang's combination, right? So what's the combination for lung? Huh? That's the worst translation I have ever seen. Lung is Jing. Jing is not metal. Jing is not metal. It's not gold or something. It's a power of constriction. It's an invisible pipeline. Like we have electricity, we have water, we have pipe to transfer them. But in we have all those channels, meridians. We don't have pipe in there, right? The only thing, the power that controls the flow is called Jing. It's a qi. It's an energy. It's got nothing to do with metal, with gold. But the lung is a combination of dryness and dampness because Tai Yin means dampness. And the meaning of that is that your respiratory system should have something to moisturize it, but not too much. When you have too much dampness in your respiratory system, you have what? Phlegm, yeah, you have nasal dripping and runny nose. When you have not enough lubrication, what will happen? You have dryness, a cough, like, right? So we have to have a combination of a balance, okay? Not too dry, not too wet in our respiratory system. You know what I'm saying so far? So the pulse for that perfect condition, not too dry, not too wet, is more than a word. Remember, the best pulse for lung is both floating and deep and powerful. The right turn, the perfect ideal pulse for the right turn, which means you have a very perfect respiratory system, no problem at all. The pulse will be a little bit of flow when you touch it gently or deeply or forceful. That's the lung pulse. Okay, I always do this in my file in my office. The 3 fingers. Okay, I always put 1, 2, 3, and this is the skin. Okay, this is the blood vessel under it. I don't do this. Okay. Yeah, that's all. I always do this. Cannot erase it? Well, whatever. It's okay. The normal pulse should be like this. The chin is a little bit of floating in. Yeah. Okay. What I said short is like this. And very floating. I'll put a picture here. It's supposed to be here. Like this in a shape. This is called short. And this is the problem of large intestine. It's not a lung problem. But also, it shows some dryness in the respiratory system at the same time. And this is large intestine. If it becomes like this, wow, there must be a lot of blockage in the large intestine. When the pulse is not extended like it should be, like this or something, or the short pulse can be here, that's kidney stone. The short pulse can be here, that's gallbladder, a gallstone or something, or cancer. This is called short. If this short pulse appear on the right twin, that's the problem for large intestine block. Too much heat.
The right twin pulse is a little bit contracted, and also if the pulse is hard.
Yeah.
Is that hardness related to the large intestine?
Yes. Yeah. The harder, the worse.
You can have a rainbow, but if it's too hard, probably something wrong with the large intestine.
Yeah.
Is that right?
Yeah, exactly. And since we're talking about this, let me tell you the small intestine. Okay? The word from Huangdi Neijing, I suggest you buy yourself an English book and study a little bit. If you can read Chinese, that's even better. Huangdi Neijing, it says, 小肠 is large and long. That's the word. Large means big pulse, very fiery. Long is like this. So it happened. This is also the finger, this twin. It's like this. On the left twin, this is the 小肠, a small intestine. Pulse. We call it rainbow pulse, just like a rainbow. You have it. Exactly. There's a lot of gas in there. This rainbow pulse, you know which part of the body the 小肠, the small intestine meridian passes? Where did it go? Where does it go? In the back. The back is, the neck area is covered by two Taiyang meridian, right? Foot Taiyang and hand Taiyang. So that rainbow pulse means Taiyang. So whenever there's rainbow pulse, there could be a pain in the neck, and tightness and headaches too, and a lot of gas. Yeah. Okay. Yeah. Yeah. Huh? What's that? Short is large intestine. Short is large intestine. And actually, I haven't finished yet. The right twin is not enough. Enough for today. Not enough for today's topic. Because the right twin is only for surface condition. For what? For cold, 感冒. It's not for lower respiratory system. It's not for bronchial. It's only for the nasal allergy or something in the upper respiratory system. Not for diagnose the cough or the asthma. Just the lower part is not on the right twin. Yeah, where is it? It's not there. That's only for allergy, for nasal, and for cold. For you to decide it's a common cold or it's a flu or something like that. It's not enough at all. So how, for example, this guy is coughing. No matter what the sound he makes, we have to decide what kind of nature of his cough or his asthma is. It's hot or cold or phlegm or dry. It's on the yang wei pulse. Can you show the 8x meridian stuff? I haven't. Oh yeah. We'll talk about that. Okay. Here. That's why I said, like I said, that the hand method is so important, because after we put on the 3 fingers on the normal condition, we have some extra meridian pulse to feel. So if you put fingers in the wrong place, then you couldn't find this. This one here, they call yang wei. That's to decide what kind of a bronchitis this guy is having. And this is the yang chao, is for the head. And also, this pulse means allergy. And this is cardiac. This is for the blockage of the heart vessels, arteries. And this is belt. Like I mentioned, you should focus on your belt because a lot of people, the upper part and lower part are not communicating. It's blocked from the middle. So sometimes we should strengthen it, or we should open it up, or we would shrink it a little. Huh? Okay, here. This is yang wei. You want to try to feel the pulse. It's very good with. So still, in that small area, you can find the dryness, the dampness, the weakness, or too much fire, or it's cold, or it's hot. Even in that little area, you want to, let's try to for a few minutes, okay? You want to go to the bathroom, please go ahead. Huh? Nope. No, it's only on the right side only. Huh? But the hand is there, but it doesn't matter. The only thing is on the right. Her pulse is interesting. Okay, let's try it for a few minutes. Let me tell you. Okay, if this stuff happen on the left hand, that means arthritis. This is just a diagram. Doesn't matter. Oh no, so he has a question first. Yeah. Okay. What's the question? Yeah, never forget about that. This is just diagram. On your right hand side is bronchitis. You have to find out nature. It's cold or hot or damp or dry. At least you should find that. Then we can use the herbs accordingly. Otherwise, you'll be using wrong herbs and you'll be in trouble. Let me show you how to take the pulse, okay? Can I borrow your hand? Okay, this is the ordinary, traditional, my traditional. 称关子, well, you're greasy. This is 称关子, right? The way to take the yang wei is like this. You do it like 45 degree to the right, to his right, like this. And this is yin wei, 45 degree spread. You know what I'm saying? Okay. Okay, thank you. Let me show you. Here is the normal 寸关尺. And this, the 45 degree, you have to change your body position. This is yang wei. If you're healthy, you don't have any problem, there shouldn't be anything. It's a sick pulse. You're sick, you have it. If you don't, don't. And this is yin wei. Yin wei means cardiac problem. You must have some blockage here. If I can find it sooner, the singer might not be, yeah. Okay. I'll be showing you another way of collecting information from your patients and now. Okay? First, check the dorsal side above the elbow. It's here. That's why I want you to roll up your sleeves. If you don't, I won't show it to you. Here, you should feel the temperature here. This area is always under close, right? You can touch it. I said it's cold or hot or warm. Warm? Who said that? No, it's not warm. It's cold. I said this place is always under close, but I said cold. This area is the neck. It's the shoulder. If this place is freezing cold, then you have problem here. I said, nobody's热. Except you have fever. It's normal. It's very good. It's cold. Even it's under clothes. Even you're strong, it's still cold. Well, this is freezing cold. Okay, how's that? If it's cold, then your neck is cold. So you have a little pain here. So if you want to treat this, be careful not to use too much cold or accurate medicine. Anybody has a hot elbow here? If you're hot, then there's a lot of stuff back in the Taiyang meridian. The next step. LI10, that's the Sosandi. This area. Now let's check this area. We have diagram? Picture? Okay, now let's check this area. Here. Okay, this is very important here. This is a hot or cold? You don't know? It's hot. Here. Yeah. It's warm. It's normal. How's it? When I take the pulse, actually before I take the pulse, I do a lot of things. I know a lot of things before I even start taking the pulse. They're just like this. What? You feel the temperature here. Here, the Sosandi, this area, this area. How's it? It's normal. Wow, it's hot. Even it's not on the clothes, but it's normal. And you should compare the temperature here with your palm. Are they similar? Or your palm is freezing and or this area is hot? How's it? Wow, it's hot. This is a little cold. Are you okay? You got too much difference there. Oh, no. When the temperature difference between here and here are too big, then you have parasites in your body. Bugs. Okay, we don't want too much a difference of the temperature between those positions because if and let's begin. Let's start again. This area is for stomach. If it's hot, then your stomach is hot. If it's cold, your stomach is cold. Okay. If the temperature here and here the difference are too much, your hand is freezing cold and this is hot. You have parasites. You have a lot of symptoms for your digestion system and sleeping problem and etc. And let's get on to here. Let's start. The hand actually is here, this area. The Daling. If it's cold, then your belly is cold. And the back of your hand is the back. If the wrist, okay, somewhere here is hot, then you do have some inflammation in the back. At the back. Do you have any problem with that? The palm, the hand is the abdominal area below the belly buttons. How do you feel? Here, it's cold, warm, or freezing. Hot means, oh, that's okay. If a lady who has too hot palms, you check her pulse, maybe there's a hormone imbalance, or maybe she's taking hormone, or maybe she's in a high risk group of getting breast cancer. It's dangerous. And the back is back. Okay? Back is back. So how's the temperature? Feel it. Feel your neighbors. How do you feel? Is it cold? Now let's look at some colors. That's even more important. Okay? I can say a lot of things before I start taking the pulse. Okay. Yeah, good. Now first we look at here. This is the lung. Just look. What's the color? Here. At elbow. That's why I want to see your elbow. Here. How's it? Dark? And don't go away. And secondly, we check here. and here, and here, and here. 5 places. There's 3 points here. There's 3 channels passing through there, right? The lung channel, the pericardium, the heart, right? And the color of here, the 内关, what's the number? PC6, pericardium 6. And here, the yu, this is called fish. This area is called fish. So I always find out some kind of blue fish and purple fish. This is the area for stomach. This is area for emotional condition. This is the area for lung, emotional, and heart. So we just observe it by looking at it. That's easy. The what? It's too small. Okay. How about this one? Okay, this is the lung. I found out some lung cancer from that. And this is the pericardium. This is the heart. And this area is the emotional area. And this is the emotional area too. And this area we call the fish. And we see the color of it, the veins. Maybe those just veins, but it means something. Okay? Well, let's take a look. At your own elbow here. If you're too nervous, you'll see some blue lines here. You have emotional problem, you have something here. You have a bad lung, you have something here. Let's take a look. Yeah, here, you're too nervous. Not too bad. Oh, this is good. The heart is not good because there's blue veins right into your heart. Yeah, this heart. The blue heart and the blue lung is not too good. It's not too bad. Yeah, the lung, this is emotional area, no good. Okay, we'll be talking about the respiratory system today, so let's focus on here and here. When we start to learn Chinese medicine, we have 8 perimeter diagnosis, yin yang, surface, 8 principle stuff. But sometimes it's very difficult. Even it's very basic, and sometimes it's very difficult for me to decide this guy is cold or hot or something. It's weak or strong. It's because human body can be very complicated, not so simple. But at least when we need help to make decisions, this will help. This is the diagnosis condition. Okay, let's try. That's very easy. You should take the blood pressure first. I take it after I make all the sayings, but maybe you should do it first. Okay, let's try this one. Type 1. Systolic is 140, diastolic is 90, heart is 85. What condition he is in? So what I'm saying is, don't mind too much about what's coming out of the patient's mouth. Whatever he tells you doesn't count. Most of the time is misleading. I don't even listen to it. So maybe this guy will come up to your office and say, hey doctor, I'm so tired, I can't sleep, I'm so weak, my face looks so pale, I have no energy, all this stuff. Then what would you like to do? If you do not check pulse before today, you don't take the blood pressure, you naturally... I have a patient that he looks so yellow and so exhausted in my office with things like this. And he also has some duodenal ulcer. But the complaint is fatigue, low energy. So what do? I got reported by my patient to authority, to the drug department or whatever. It's not FDA, PPA, whatever. They sent 2 investigators to my office. Says somebody complains that your medicine may have some steroid in it. I said, go ahead, take whatever you like. And then look at the file. The guy was, the reason for his complaint is he feels so macho, so strong, and so happy after taking my herb. He suspects there's something in there. So he report to the authority. Okay, that's good. It's difficult to be a doctor. If you treat them well, they get complaints. If you treat them too well, they're reported. Oh my. What do we do? Give them something like powders and go away. The reason for that guy was a heavy drinker. He drinks 3 bottles red wine every week. So a major complaint is weak. I mean, he's tired, fatigue. I gave him 右归丸, 贵附地黄丸, or the kidney yang. He is impotent. Something. I gave him, and the 蛇床子, 韭菜子, all for kidney yang. Wow, he feels so good afterwards, and he got suspected. Middle age, 40 or something. No, he never showed up after that. It's difficult, huh? If you're too good, then you have trouble. If you're not good enough, the medicine doesn't work, you get complaints too. Okay, whatever. Okay, so what about this? So what if the major complaint is fatigue, low energy level and everything? So what would you give it to him? But according to this, as we already have this information, so what kind of medicine would do not give it to this guy? No matter what. Huh? Yes. Such as? Huh? What kind of medicine would do not give it to him? No matter what he asks. Huh? 补中益气汤. Anything else we do not give it to him? No matter what. 附子. Okay. I don't use that singly. 十全大补, okay. He is tired, doesn't matter. What kind of medicine we do not give it to him? Anything else? Warm. Yeah. Actually, this too, you're right about this, not giving this too. But let me give you a little hint. These two medicines are working for the middle part, for the daimai. Actually, it should be working for the weak daimai. Remember daimai? But in our theory, in our advanced class in Oakland, July or something, I'll be telling you that something also behind a weak qi. Let's pretend this guy is very weak, pale and anemic, and we do not. This is the direct approach. He's weak, so we tonify it. It's a very natural thinking. But there's something more advanced. We should do something to the guy behind this stuff, such as fire. In our 5-element theory, fire produces what? Those words are really confusing, right? Well, fire produces earth. Earth produces what? Okay. But the true meaning of those relations, fire means kidney. The kidney yang that produces earth is enhancing the digestion system. And jin means qi, that's energy, so simple. So if you want to give him more qi, you not directly only use the 补中益气. You use something from down below to tonifying the kidney yang, like 右归丸 or 环少丸, something like that. That's a more advanced usage. For example, if somebody have diarrhea for a long time, you do not just use astringent. You use something to tonify kidney yang. When there's a fire, the rice will be cooked properly, right? When there's not enough fire to cook, the rice will be still raw.
Are you saying then that the 5 elements that Shaoyin is represented by fire element?
So then the water element.
There are a lot of fires. The good fires and bad fires. Good fires is right, kidney fire and heart fire. Bad fire can be anything. Okay, we're talking about good fire. So heart fire is the emperor. He doesn't help anybody. Kidney fire is the sex fire. That helps a lot, like hormone stuff.
And what about the water element? Is that a Shaoyin element as well?
Water for kidney is like a coolant, like a water tank of a car, to cool it down, to balance the stuff. And actually, it is the water. Okay, water. This word in kidney. Kidney is a combination of fire and water, right? The water means in. The definition of in means something solid. Yang means something. It doesn't occupy three-dimension stuff. What's the thing that doesn't occupy? Doesn't have the three-dimension?
Air.
Air, voice, chi, energy, space, horsepower. You cannot see a horsepower, right? But you can see a big engine. Big engine means in. Solid stuff you can see, you can touch. That's in. So the kidney in means what? Water is only part of it. Means substance. Ovaries, eggs, sperm, water, everything. And even the organ themselves. That's in. So it translated into water. This is a very confusing word. It's very difficult to understand the true meaning of it. So yang is energy. Like horsepower. Well, the car has horsepower. You cannot see the horsepower. But you can see the engine, right? The engine is in. So the water is a bad word. You just remember the in. In means solid. You don't have enough eggs, you don't have enough sperm count, that's in. Okay? That's the definition of the in.
So what you're saying is if the earth element is weak, provide more fire from the Shaoyin.
Yeah, will help the stomach. So when you treat the stomach, you should at least have the idea that you might need to treat the kidney yang. Not just some anzongsan or xiangshao something, not so direct. I like using indirectly. Works better. Like I was telling him that when you play checkers, the good player can see 5, 6 steps beforehand. So that's what I'm trying to do. Okay? What? What's that?
She asked about what is ministerial fire.
What do you mean ministerial?
是上交 and pericardium.
上交. 三交. Shinbao is the emotional condition. That's emotion. Got nothing to do with anything else. I haven't finished yet. What about that guy, the weak guy with this? What do we do? Can we do something about him? What? No, don't come back. Okay, type 1. Whatever you do, don't give him something tonifying, like Sichuan Dabu or something. Anything we can do about that? At least we can use some cold medicine to cool it down. If you want to make him feel better, both with energy and the blood pressure stuff, you should concentrate at least for liver and blood. When you treat blood, you treat when you treat the liver, you're concerned with the fire. So anything we can lower the liver fire. We're not taking the pulse, but we just give a general idea,
Okay, guys, we're going to go ahead and take a short 10-minute break now, and we will see you guys back at 10:25 a.m.